Good afternoon. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer for Manitoba. Today, there are no additional deaths due to COVID-19. The current 5-day COVID-19 test positivity rate is 12.5% provincially and 14% in Winnipeg. As of 9:30 a.m. today, 497 new cases of the virus have been identified, and the total number of lab-confirmed cases in Manitoba is 50,144. As announced on Thursday, stronger public health orders take effect tonight because our health system is facing critical pressures that are not sustainable. Manitoba's ICU numbers and hospitalizations are extremely high and are still expected to climb in the third wave. The public health orders clearly outline what we need to do. We need to stay home and work from home if possible, only go out for essential items when absolutely necessary, and only send one member of your household. If you usually go as a family or with your spouse or partner, we are asking you to only send a single person. And do not gather with anyone outside of your own household. If you are camping this weekend, only camp with members of your immediate household. The significant changes to the orders include employers are now required under the order to allow employees to work from home where possible. And malls will have increased requirements to manage capacity and access to ensure stronger compliance. Remote learning for K-12 schools in Winnipeg and Brandon and in the Red River Valley and Garden Valley school divisions will continue in remote learning until June 4th. Schools in Dauphin will continue in remote learning until June 9th. The orders put into place ahead of the May long weekend remain in place. The new orders start on Saturday, May 29th at 12:01 a.m. and will remain in effect until Saturday, June 12th at 12:01 a.m. I know stronger orders are not what you wanted, but we need to step up and help protect our health system and the health of all Manitobans. There are too many people in hospital today struggling for their lives. We have to stay home as much as possible. We have to reduce our number of close contacts. We have to wear masks when we're around others from outside our households, even outside. We have to make an appointment to get vaccinated. Right now, it's up to all of us to take steps to protect each other. By taking action and changing our behaviors, we will bring cases down and help end the third wave in Manitoba. Practice the fundamentals and stay at home. I wanted to add that due to ongoing health and safety concerns resulting from the third wave of the pandemic, Community Living Disability Services funded day services for adults with intellectual disabilities will continue to be suspended for additional 2 weeks in Manitoba. The suspension will extend until June 11th, 2021. Some exceptions may be made where the safety of individuals cannot be managed in residential care or at home during the day. The Department of Families will continue to support the redeployment of day services and transportation staff to individuals' places of residence. Individuals are encouraged to follow current public health orders and to use virtual meetings and other technology to stay connected with friends, families, and the broader community. Thank you. I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Bart.
Hi, Dr. Atwal. Given the fact that public health has been aware of dozens of workplace clusters for weeks and months in some cases, why only yesterday announce that work from home requirements would be placed in the public health order and that you may actually shut down more of these workplaces where there are multiple cases and no transmission risk? Why did it take so long for Manitoba to do that?
So I think first we need to understand what a workplace cluster is defined as. We've been dealing with workplace cases all through the pandemic with clusters related to workplaces. Just because there's a case in a workplace or 2 or 3 cases, it doesn't necessarily mean that there's a cluster related to transmission at the workplace. Depending on which report we're looking at, the definition of a cluster in a workplace is 3 or more cases from 3 different households. Regardless of where they acquired it, that's just a broad definition. So anytime something like this is identified, greater work is done on the public health side. A medical officer of health is involved. I've been involved in a number of these as well. And what happens is, as we go through the acquisition events, the transmission, what happens in that workplace, more often than not, it wasn't the workplace where transmission occurred. It happened, let's say, with a carpool coming to work. It happened with someone getting together on the weekend. It happened with a breakdown in protocol, per se, at the workplace as well, where the act of working wasn't the issue, but during a lunch break, everyone sat around a table, and there was a risk of transmission there. So there's a number of variables here, and I know there's a broad number out there related to workplace clusters, but when you break it down, yes, there have been some instances of transmission within the workplace and the setting of it related to a number of different factors, but the majority of these cases related to workplaces, it's not the workplace that is the issue. It's things surrounding it, like coming to work, leaving work, you're friends with others at work, getting together at a social gathering, or having a little bit of a breakdown in protocols that workplaces have put in place. So, we've been open to providing information related to outbreaks throughout the pandemic. We'll continue to do that. At this point here as well, we've taken another measure to make sure that on the public health side, we're aware of cases within workplaces sooner rather than later. And one of the issues here is our public health information management system, where when a workplace is entered, unless the workplace is specifically identified, it's more of a text format. It's hard for us to recapture that information. So in this instance here now, what's going to happen is we're going to have a central repository, whether it's email or a phone call in from a workplace, where we'll get that information. And from that, we'll be able to ascertain, is it truly a workplace issue with something happening at the workplace through another investigation, or is it transmission occurring outside the workplace? So that's what we instilled right now from an order standpoint, to make sure we're capturing that more regularly and earlier on when cases start to get generated within a workplace. And there are differences in workplaces too. You have workplaces with one person or two people, and you have workplaces with 2,000 people. 2 cases with 2,000 workers over multiple buildings with lots of community transmission. It's not unexpected. 2 cases in a workplace with 4 or 5 people, that might be a little unexpected, right? So there's different levels of risk here. So again, with the public health investigation, with the medical officer health involved, we go through each one of these workplace clusters to really figure out what's going on and to work with the employer if there are issues identified at the workplace. But again, the vast majority of these issues are outside of the workplace.
I hear you say that, but I have to, logically, there's something that doesn't make sense. You say it's outside of the workplace, but when people are breaking protocol at lunch, they're at work. They wouldn't have that protocol broken if they were at home. If people are carpooling, they're carpooling to work. So can you please explain to the general public here how workplace-involved activities are not involved with workplace?
So again, most of the transmission happens outside of the workplace, perhaps traveling to the workplace or leaving the workplace. The issues in the workplace is usually there's a protocol in place. We have protocols in hospitals. We have guidelines in hospitals as well, and sometimes there's a PPE breach, right? It doesn't mean the whole workplace is at risk. It doesn't mean everyone's doing something wrong. So those protocols exist there, and we still see once in a while a breakdown there. It happens. We're humans. We're all gonna, make a mistake once in a while, and sometimes that leads to a risk of transmission. In these workplaces, a lot of workplaces have policies in place. We've been advising, we work with sectors to look at these policies to provide that guidance from public health. And sometimes, again, we're way into a pandemic. There's a bit of fatigue there. Sometimes there's a lax moment that occurs. Sometimes maybe the workplace, you're right, maybe didn't have that protocol in place. And that's where, once we find this, we identify it. Again, we work with that workplace to, ensure if there was a risk at work, that risk is addressed.
From the Canadian Press, Kelly.
So today we heard that first dose appointments are starting to lag. What are the reasons and what strategies will be employed so that Manitoba can meet its targets of a minimum 70% of vaccinations by the end of June?
Yeah, so, there's a lot of work being done on the vaccine side. There are a lot of appointments that have already been booked. I don't know what percentage of the population over 12 has an appointment booked, and that'd be a great question for the vaccine task force. There's still appointments being booked, obviously. They might be a little bit slower than they were in the past, but there's still lots of appointments being booked. We've opened up second dosing appointments as well for individuals, and that started for those who had their first vaccine prior to April 3rd to start booking for your second doses. We're working with communities. We're working to identify pockets or areas where there might be a lower vaccine uptake and look at some strategic measures to provide vaccine a bit more locally, to work with local leaders, to work with local populations to see if we could improve vaccine uptake as well, to get that vaccine uptake. Because it might be an accessibility issue. Right? It might be an awareness issue as well. So there's lots of potential gaps here that we're going to work with community leaders and communities in general to try to get more vaccine out to more of the population and to target those areas where there's perhaps less vaccine uptake than expected.
And there's expected to be another rally today of people gathering together. What do you have to say to the people attending these kinds of events, even now as, you know, we have another big day of cases and hospitals are on the cusp of being overwhelmed?
Yeah, I think you know, people attending rallies or organizing rallies have to maybe open their eyes a little bit here, right? Our acute care system is really struggling. You know, we have, as of this morning, I believe the number is 26 people in intensive care out of the province. You know, we've got 69 people in our own ICU, and we've got 312 people in our hospitals in Manitoba. We've got 94 or 95 Manitobans in an ICU situation, whether you're in Manitoba or another province right now. Those are real numbers. Those are real people. You know, we know how this virus transmits. We know that there's risk there for hospitalizations. We're seeing younger individuals hospitalized. We're seeing younger individuals in the ICU. We're seeing those with really no medical problems as well, not only hospitalized, but in the ICU. So I think, you know, we really need to understand the risk here with COVID. We're 15 months into it. We have our own data. You know, we are shipping people out of the province for care. We have canceled thousands of surgeries. People with significant medical conditions are being delayed surgeries because we need the staff to help out all these COVID patients. So having a rally poses risk. You know, having a bunch of people come together poses risk. It's potential for that super spreader event. It's a potential to generate cases where right now we don't need to generate more cases. We don't need to generate more hospitalizations, and we're trying everything that we can to prevent that from happening. So I really encourage, you know, these individuals to think twice about what they're doing. You know, this is impacting Manitobans. This is going to impact your friend, your neighbor, perhaps a family member from getting the care that they need locally. So really take that into account. If you're going to protest, protest virtually. I'm not saying don't protest. I'm not saying that's not your right. But to do it with others in a live situation poses risk, and we need to mitigate that risk.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. I'm wondering a little bit more about the workplace transmission. Unless you have a stay-at-home order, people might feel the need to go to work, or they feel obligated to still go to work if you know, their workplace is still letting them do that. So why not have a stay-at-home order? Why are we kind of stopping a little bit short of telling people to stay home?
Well, I mean, our orders are essentially a stay-at-home order. They're not called stay-at-home orders, but it is essentially stay at home. Only go out for those essential things. You need something, send one person, go get what you need, come home. Don't do anything with any other household. There's a lot of workplaces out there. You know, we encourage employers that if you know your employee can work remotely, let them work remotely. But there's a lot of jobs out there, a lot of different scenarios, and public health, you know, we don't know every single scenario. And it's hard writing in exceptions, right? We're going to have 100 exceptions, and once you put in orders in place, there's going to be more and more exceptions that occur. So, you know, we're asking, you know, Manitobans to work with their employer. We're asking the employers if it's reasonable that the work can be done at home, let employees work at home. A lot of workers still have to come into work as well to get those essential things done, to make things that are essential for Manitobans, for other Canadians, to take care of Manitobans, you know, to ensure that we can get food to ensure that we can, get medicine. There's all these other things. A lot of our jobs are tied into providing important services to Manitobans. So the order in relation to getting people to work at home it's there. We want to encourage it and do it as much as possible, and we really want employers to allow that to occur.
Thank you. I'm also wondering about AstraZeneca. The government or the task force is still recommending the 12-week intervals, but can pharmacies offer it sooner to those who want it? And is that a smart thing to do?
Yeah, we've recommended the 12-week interval. We're looking at our vaccine recommendations on an ongoing basis. At this point, that recommendation hasn't changed. There's going to be ongoing work done on this over the weekend as well and early next week. And I think, the vaccine task force will have greater information on AstraZeneca specifically and the other vaccines next week as well.
From City News, Mike.
Hey, thanks for that. Good afternoon, Dr. Atwal. My first question is just about the military help coming to the province. Can you specify how this military assistance will be utilized and how much the province may need the help right now?
That's, I really don't know the answer to that. I know little bits of it, but I don't want to provide any misinformation. I think Shared Health would be the best people to ask that question, as they'd have the greatest line of sight on that.
Okay, understandable. My follow-up question, we've had someone recently from Ontario say that they were not allowed to travel to Manitoba for first aid and water rescue training, and they had to go back. Is this the same type of turnaway method that can be used in the future if, say, someone like Chris Sky once again decides to return to the province to host a rally?
One person was refused when they came from Ontario for what kind of training?
For first aid and water rescue training. They were told they had to go back.
Yeah, so, there are orders related to self-isolation related to travel. There are exemptions within the orders to allow training to occur for essential reasons and essential purposes. There might be a little bit more to this story. So a question like that could come through our stakeholders relation unit so we could better understand the variables involved, who this individual is, who they work for, to better provide an answer for that question. So we do allow training to occur for essential reasons. There might be a little bit more to that than what you're aware of or what's been provided so far.
May I alter the question, or is it my time not, Paul?
From CHVN, Taylor.
Hi, good afternoon. How many cases have come from the workplace, and what kinds of workplaces are you seeing being the most common for having workplace transmission?
So I don't have specific numbers related to workplace cases. Obviously, there's going to be lots of cases where perhaps somebody, in the previous 14 days was at their workplace. That doesn't mean acquisition occurred in the workplace. Obviously, a lot of workplaces are going to be identified if someone does become a case when they were pre-symptomatic 48 hours prior to symptom development. Were you at work? Where do you work at? I mean, those are going to show up in those data points, right? You're going to have acquisition events related to workplaces. You're going to have potentially transmission events related to workplaces. So those are two different numbers. Once we go through these investigations with the case, once we look at the workplace, once there's cases identified in a workplace, again, most often the workplace isn't the issue. Most people right now who are out and about are working. You're working 5 days a week, you're working 7 days a week. That workplace is going to show up if you do become a case. Does it mean the workplace caused the case? That's the better question to ask. That's the better question to answer. So again, just going back to the previous question about this, most times when a workplace has been identified as an acquisition event in the previous 14 days or possibly a transmission event in the previous 48 hours if one becomes a case, once greater investigations are done, the workplace wasn't the issue. It was something else. It was, the carpool there again. It was, getting together on the weekend with a fellow employee. A lot of people who work with others, they're friends with others. Or there might be family working together and they have a social gathering afterwards. So, I think that's a better indicator of workplace issues. And again, public health is involved in all these sorts of scenarios and clusters, and we work through them. A medical officer health is involved. Sometimes workplace safety and health is involved, depending on which company is involved as well. And that's not to say there hasn't been workplace transmission. We get that. There is workplace transmission that occurs, but on a grand scale, it's minimal compared to things surrounding work, things outside of work, and those other social gatherings that occur.
Thanks. And we learned today that Manitoban adults have the highest rate of vaccines in the country, despite opening up appointments to adults less than 3 weeks ago who are 35 and older, and all adults just opened up 16 days ago for them to get the vaccine. I know you said most people who are in the hospital are not vaccinated or protected by a vaccine yet, but can you explain why there are so many people in the hospital who are not protected by this vaccine when we have the highest rate of vaccine uptake in the country?
Yeah, so on the vaccine side, when we brought out that stat that maybe 90% of individuals who were in hospital hadn't had a vaccine, or they hadn't developed immunity to a vaccine because it was within the first 14 days of getting that first dose. The point there was, it's the power of the vaccine. The vaccine's powerful. We're not seeing vaccinated individuals after 14 days of their first dose or their second dose being admitted, really. There's small numbers in comparison to others. Obviously, there's going to be delays in, when you're able to get your vaccine, getting that vaccine and waiting that 14 days to get immunity. So that statistic, to me, from a public health perspective, talks about the power of the vaccine. That statement made people who were a little bit hesitant go get vaccine. I've had nurses come to me who said, my parents were hesitant to get the vaccine. Once they heard that most people in hospital hadn't been vaccinated, they booked their appointment. It's a powerful message, I think, on the vaccine side. Now, vaccines are available for those 12 and up. So again, it's one thing having availability to make your appointment. It's another thing getting that appointment. Let's say it's 2 weeks down the road, and then let's say it takes another 2 weeks to get that immunity developed from that first dose. So that's a 4-week window. But we are still seeing those admitted who have had access to vaccine. They've had access to vaccine more than 4 weeks ago, who haven't gotten the vaccine. They end up in an ICU or they end up in a hospital bed. So, this is about educating. This is about showing people the power of the vaccine. It's a safe vaccine. Hundreds of thousands of Manitobans, over 700,000 Manitobans have gotten a vaccine. We're starting into second doses. We're seeing the powerful effects of the vaccine in preventing hospitalizations, preventing illness, preventing transmission, preventing an ICU stay where right now you might be flown out to another province to get that ICU bed. So to me, from a public health perspective, again, that's the importance of the vaccine. And that number was there to illustrate that fact.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. I'm a bit unclear on how the province is going to enforce any work-from-home requirements in the public health orders. How will you ensure employers are respecting the public health orders and, the requirements of their employees to stay home when they're sick?
Yeah, I think a lot of employers, most people are good people. Right, most employers, most people who work for employees are working there not because it's a bad environment, it's a good environment. There's exceptions, I get it. I think people realize the seriousness of of where we're at right now, and I think people are already working from home, right? So a lot of employers have allowed that to occur. The businesses are still running, they're managing. Some employers, they can't do that, right? But are there still some people perhaps who are coming to the workplace who could work from home? And that's where the employer needs to look at all their employees. If an employee feels like, hey, in my job, I'm a desk job, I don't need to be at work, it's all computer-based, I could work from home, they should talk to their employer and see if they're able to make that transition to working from home. So, we're asking for employers to work with their employees to look at this. It's an important step here to, again, limit and mitigate spread of a virus. We want to, try to keep people as home as much as possible. And in some degree, you're right, we are trusting employers. But I think, like I said, most employers are good people, and I think everyone's going to do the right thing to make sure that they follow that order.
Can public health make any recommendations about implementing paid sick leave as part of those orders?
Well, the orders are in effect on Saturday at 12:01. Right. So, I mean, I think, every effort should be made to make those allowances for employees if it is reasonable and deemed possible.
From Global News, Joe.
Afternoon, Dr. Atwal. So many in the business community would like to see a reopening plan. No one is calling for a reopening now or anytime soon or taking away from the seriousness of the current situation. They just want to, one, be able to get an idea of when they can start hiring staff, placing orders, and that type of thing. And two, it would even show that there's some hope while we go through like these dark times. So what's the message to the business community?
The hope is there for sure. We've sort of alluded to it before. We are in a bit of a tough state right now. Our case numbers, we've been, at the trailing 7-day averages of, mid to low 400s for, over 2 weeks now. We've got hospitalizations that'll still increase over the next week or two, and ICU visits. And we need people to bring those case numbers down. We need adherence to the orders, because otherwise, if we continue to generate cases at this level, it's going to be even more impactful on the acute care system, right? So, we are discussing that at Public Health. We have some ideas. I think we've seen other jurisdictions provide some high-level guidance in relation to a reopening strategy. I think ours is going to look similar. The numbers might look different, but the principles are there. We got into the third wave later than other provinces, quite a bit later, and they're coming out of the third wave now. So over the next couple of weeks, I think there'll be some more messaging related to this, and perhaps something that could be finalized to provide to the public. But at this point, it's just a little bit too early. We still have to see and manage what's happening in Manitoba right now. We have to get no more ICU admissions out of province. We have to see our case numbers come down. We have to see our hospitalization numbers stabilize. And I think that's the focus. That's where that focus should be for Manitobans. Hope is there. More and more people are getting vaccinated. I believe over 100,000 Manitobans got vaccinated last week. We need to keep those vaccination numbers up, book those second appointments. I know it's hard right now. I know it's really hard. It's been a long, enduring time here with this pandemic. There's a lot more light at the end of the tunnel. It's dark right now, I get it, but there's a lot more light at that end of that tunnel. And we're going to try to look to provide something to the public, hopefully in the next couple of weeks' time. But again, our priorities right now are dealing with what's happening right now in Manitoba, and a lot's changed, compared to even 4 weeks ago to now with what's happening in Manitoba. So stay tuned for that reopening plan.
Thank you. And today we heard that we likely won't be hitting that 70% of first doses by June 9th. Instead, we'll be just shy of that with the new target for the end of June. So how big a concern is this change for public health? Does this really throw off planning and projections, or is this a minor bump in the road?
It's. I think it had to do a little bit with the Moderna supply disruption a little bit. So we are going to get those doses out. There's more and more doses coming in. We're going to get second doses ramped up right away. I don't think this is a significant impact on what happens from a public health perspective. It's a delay of, let's say, maybe a week or 10 days in relation to number of vaccines put out. I don't know the exact number. I'm just using that as a reference point. A week in a pandemic doesn't mean much. When we're trying to look at getting out of a pandemic. We still have to practice those fundamentals. We have to go get tested. You get symptoms. Don't wait 3 or 4 or 5 days. You get symptoms, go get tested within 24 hours. Go get tested. If it's positive, work with public health to self-isolate. If you're having issues with self-isolation, public health will help you self-isolate. We have a lot of resources there to address any issues you have. You need food, we're going to find a way to get you food. You need someone to help you out with your kids or your extended family in your home, we're going to help you out. If it's easier getting you out of that house, we're going to help you out. So work with public health. Key thing here is get tested. Don't wait. Don't wait until you end up in hospital. Again, within 24 hours of getting symptoms, go get that test. It's going to be paramount in our ability to keep case numbers down, look at case and contact management, make it effective to help people out who need that help, right? This isn't about hurting someone. This isn't about giving someone a ticket. If you develop symptoms, you test positive, you're a case, but you hung out with your friend and that's how you got it, we're not going to give you a ticket. We're going to help you to find a way to self-isolate properly to mitigate the issues related to spreading COVID-19. That's what public health is going to do. So I really want to stress the importance of that.
From the Brandon Sun, Colin.
Good afternoon, Dr. Atwal. The 80 cases in Prairie Mountain Health today is the highest single-day case count our region has ever seen. What are the factors causing this record-breaking day for us?
Yeah, so that was a high number of cases, and I believe that just about half of those cases related to First Nations communities. That's still impactful. That's very impactful for those communities. So it didn't really necessarily have to do with Prairie Mountain as a whole, but also it had to do with clusters related to smaller First Nations communities where we know, there's housing issues. There's multiple individuals living in homes, and First Nations communities have struggled with this all through the pandemic once a case gets into a community and how it can spread.
I noticed that our number of hospitalizations and ICU patients went down a little bit today. Do you believe that this is a start of a positive trend, or is it too early to get our hopes up that the strain on our hospital system and our healthcare system is lessening?
Yeah, so, in total, we actually have 95 in ICU, right? So that includes 69 in Manitoba plus another 26 out of province. I don't think our hospitalization numbers and ICU numbers have plateaued. I think we're going to see an increase. We're probably going to see an increase next week and probably the week after, considering our 7-day rolling averages really are still high. We're still sitting over 400, again, since May 9th or May 10th, and that's been more than 2 weeks. We're kind of hitting day 16, 17, whatever that day is. So we're still going to see a bump up in our admissions. We're going to see a bump up in our total number because convalescence, the time it requires to be in hospital to get over COVID is a little bit longer as well. And I think we're going to see a continual rise in ICU cases. At some point it plateaus, for sure. But I think it's not happening this week. I think maybe in a week or two, depending on our case numbers. We need our case numbers coming down. If our case numbers don't come down on a week-to-week basis, we're going to have a steady state of increased hospital and ICU admissions over that period of time for the next 1 or 2 weeks, right? So our case numbers are still at a certain level. If they start to come down now, starting right now, let's say, maybe in about 2 weeks, our ICU and hospitalization numbers plateau. So that's what we've seen from previous waves. That's what we've seen in other jurisdictions as well, and that's what we would expect here. So definitely not plateaued in my eyes, and I think we're going to continue to see an increase in numbers related to hospitalizations for sure.
From CJOB, Clay.
Good afternoon, Dr. Atwal. I just heard you speaking about you expect ICU numbers to actually go up within the next week, maybe 2 weeks. Our numbers did come down for a couple of days, and now they're back up to almost 500. Can you, based on that, what do you envision the kind of summer we're going to have here in Manitoba?
It's always hard to predict that future. Every time we say something, it may come to fruition, it may not. It's challenging. What I can say is we had lower case numbers. The days we had lower case numbers, they were associated with lower testing volumes as well, right? So Manitobans, again, we threw out a number before where a number of people are coming to hospital and their first test for COVID is when they come into hospital. I think that number was 43%. And some people, perhaps, they got sick really fast, or that was, they came into hospital and they had, mild symptoms, but another reason brought them into hospital, they tested positive for COVID. We recognize that. But there are others who are waiting. There are others who have been sick at home for 5, 6, 7 days, because it usually takes several days of being sick before someone ends up in hospital with respiratory issues that are COVID-related that require admission or an ICU bed. So when we don't get those cases generated from that, when people aren't testing, it kind of makes us a little bit blind, in quotation marks, and related to what is a true case generation number. And perhaps we're seeing some of that here because our cases are in the mid 400s, but our ICU numbers are probably disproportionately higher related to that. But there's a number of variables here. It's hard to know, but we definitely do need to see those case numbers coming down. We do definitely need to get the ICU numbers plateaued, and that'll happen after those case numbers come down. I think the important thing here right now for Manitobans is, again, if you're sick, go get tested. Don't wait. Go get tested. Let public health manage you, your family, your contacts to really mitigate the spread of COVID-19, to limit the impacts on the acute care system. When you're identified as a case or a contact, you're going to get regular phone calls from public health to see how you're doing. It might mean, better care if you are getting sick, right? If you are getting sick, we're going to send someone over perhaps, or we're going to tell you to come in and get care sooner rather than later. So work with public health, work with the orders, work with the messaging, and that's how we're going to get out of this third wave right now. How long this lasts, what does summer look like, that's a tough question. And that's a tough question for a various number of reasons, because there's going to be impacts on our acute care system, after our case numbers come down. So we're hoping for some sort of resemblance of a bit of a normal summer, for sure. I think we're all hoping for that. Things change rapidly, so we're going to know week by week a better idea of where our case numbers are, hospitalization numbers, our ICU numbers. Our vaccine uptake is going to have a profound impact on our ability to do things, to take restrictions off of individuals, to prevent cases from being generated. And every week we're having tens and thousands of Manitobans vaccinated. We're going to continue to have that with the first dose. We're starting those second doses as well, and that's going to have even a greater impact in creating immunity, in creating that immunity that will get Manitoba back onto, doing those things that we all love to do. But it is too early to talk about summer at this point and what that will look like.
What's your thoughts, as my follow-up, on interprovincial travel? Been suggested some people would like to travel to Alberta for the upcoming Calgary Stampede. Any thoughts on that?
I think we're very clear. Stay at home. Don't interact with others. Period. It's not complicated. You leave the province, you come back, you have to self-isolate. That's the message. It's a simple bullets. It's very black and white. Stay at home. That's my message to them. I find it amazing that people want to put themselves at risk, their families at risk right now, and bring something back for non-essential travel reasons, right? It's challenging, I understand. I think we're all in this as Manitobans. We're asking all Manitobans to do the same. So my statement to them would be, don't travel. If you travel, you will have to self-isolate when you come back for 2 weeks.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Atwal. I'm going back to the workplace transmission stuff because I'm trying to understand how we can say that workplace transmission is minimal when we have no real data to provide the public to back that up.
Yeah, so again, we don't have data that's presentable, I would say. I think we'd have to find a way to present that, and that's going to involve a lot of work. Anytime there's clusters in workplaces, public health is involved, right? We have public health nurses involved. If the workplace has an occupational health officer for larger facilities, they're involved. If they're smaller facilities, public health inspectors are involved, public health nurses, and also a medical officer health. And we review each and every single case related to a cluster to determine where the risk was. Do we compile that data in a fashion that's presentable? And the answer at this point, to best of my knowledge, is no. We're trying to find a way to do that. It's going to involve a lot of work, and there's a lot of other priorities that we have right now. So we're going to try to figure out a way to present that. We have broad, high-level data looking at acquisition events, looking at where potentially transmission may occur, but that includes everything that happens in a person's life. It doesn't just include the workplace. So being involved, I have been involved with investigations with workplaces. All of my MOH colleagues have been involved in those processes as well. Workplace safety health has been involved as well. And again, most times we find it's not a workplace issue. It's not an issue within the workplace. It happens outside of the workplace. That being said, sometimes there are workplace issues. Could be, again, a break room. Could be, again, a breach in a protocol, a breach in PPE. There's other variables there, other instances as well, but in general, we're not seeing that transmission to a significant degree in the act of working or with work. It's outside of that.
Thanks for that. My follow-up is there seems to be a disconnect, I guess, between public health and it's, the people of this province when it comes to messaging and public health orders. We know that messaging doesn't always work. We've found that the orders, at least if we're looking at the second wave, have shown that they do when it comes to, driving numbers down. And when it comes to this whole stay-at-home messaging, essentially you're telling people there's no order for that. And so I'm wondering why is so much effort put into this messaging rather than just putting it on paper into an order?
So I think our orders are very clear what someone can do and can't do. There's no gatherings. Anything you do is with your household. So I understand, perhaps there is some confusion, but I think it's fairly clear here. You can't go out, you can't go for walks with your neighbors. It's your household only. You could be on your property in your home with just you and your family. If you're going out for an essential errand to go pick something up like groceries or something that you need at home, it's one person who's going. And there's limits on capacity in those stores as well. So, whatever we do, I think there's always going to be another side where someone says, you should do something different. You should message it this way. You should do it this way. This is the way we're messaging it. This is the way we've drafted the orders. There really isn't, it is a stay-at-home order essentially without actually saying stay-at-home order. It could say stay-at-home order and have all these exceptions attached to it, but we've crafted the orders where they are essentially stay-at-home orders. So, the message is, the orders essentially are stay at home, only leave for an essential errand, and don't interact with anyone. If you go through the orders, that's what it states. If you're listening to the messaging, that's what we're messaging. It's fairly clear from that side.
From the Neepawa Banner, Ken.
Hi, Dr. Atwal, and good afternoon to you, sir. Wondering we've had a group of doctors and a number of other people have been asking for a stricter or total lockdown. What do you think that means, and is it being considered?
Yeah, I think we've sort of discussed the orders. This is essentially a lockdown. You could term it a lockdown. You could term it a stay-at-home order. You could term it something different. The orders allow people to do very little. Again, the orders only allow you to do something with you, yourself, and your household. That's it. It allows you to go get an essential item or something that's required for your home. That's it. That's all that's allowed. So I'm not too sure what more we can do. There's a couple other things, but I think we're trusting Manitobans to be aware of the seriousness of what's going on right now. We are shipping people in planes to go to another province to get care. We are delaying surgeries that are critical for Manitobans so that people with COVID could get care. We're generating cases still where we shouldn't be generating as many cases if people follow the orders, if people follow the messaging. So we need to really stop that gathering and really adhere and listen to the orders. And again, when the opportunity comes to get that vaccine, make that appointment, go get that vaccine. I think those are the key elements here right now.
Follow-up question to that is, do you have the statistics on how many people overall from the beginning have been put into ICU, and what is the survival rate of coming out of ICU?
I don't have that number on me, but that's something that Shared Health can get to you for sure.
From CBC National News, Cameron.
Hi, Dr. Atwal. Just want to kind of go a little deeper on workplace transmission. We'd like you to clarify a bit more here. Over the last several weeks, we've heard from yourself, Dr. Rusin, warning about the trajectory that this province is on, and we followed a bad trajectory here. So why has it taken 14 months to come up with guidelines for workplace clusters?
We've worked with workplaces at the beginning of the pandemic. We have guidances in place for different types of workplaces. We have general business guidance in relation to managing your workplace. How to prevent COVID from entering the workplace, how to prevent employees from interacting to prevent transmission within the workplace, or if the business deals with the public, putting in mitigation factors related to that. So that's happened all along. We've had workplace cases right from the beginning of the pandemic. We've had some clusters related to workplaces from the beginning of the pandemic as well. And again, public health has always been involved. Once we see multiple cases in a workplace, there's definitely a greater work done on the public health side to ascertain what's happening at that workplace. So it's not that it never happened. I think maybe it's just sort of hitting the news right now. I'm not too sure. But we've always been involved. We've always worked with employers. We've always worked with these businesses. We've also worked with business sectors and people who represent business sectors in providing information, providing ways to mitigate COVID-19 issues. And then when those businesses are impacted with COVID-19, whether it's a direct impact with transmission occurring in the workplace or outside of the workplace, which we don't know right off the bat, we still have to do that investigation, then we work with them directly as well. So we've always been involved, we are involved, and we're going to continue to be involved.
So, framed another way then, why didn't we do this after we saw clusters in places like Maple Leaf, Excelsior? In retrospect, would it have been a more useful tool to have the tool to shut a place down like we have now earlier?
Well, public health has always had that ability to look at a health hazard order, emergency health hazard order to shut something down if it was felt it was a hazard to the public or a hazard to employees, let's say. With outbreaks in different facilities, businesses, again, we were involved with those businesses. What this is doing here, what this order is doing is, once 2 cases are identified in a business, we're going to get a call or we're going to get an email. So we're going to be a little bit more aware earlier on. So the way we collect public health information is we do collect where somebody works. Now you've got to imagine hundreds of people entering information into a text form in a computer. When you write down business X, and let's say there's 100 other businesses named X in Manitoba, it might not, it doesn't connect it with another business named X unless we go down and actually put in the address, or sometimes people don't know the address, so they say it's at the corner of these 2 streets, that's where I work, or that's where I've been. So this allows us to learn about cases that might be a cluster, so in a business sooner, right? Rather than, let's say, several days later or even a week later, depending on how information is coming in. And we have different people all through the province working on case management, right? So you might be a public health nurse in the Northern Health Region, but because most of the cases right now are being generated in Winnipeg, you might be providing a case investigation to someone in Winnipeg. Right? So there's these data systems that really don't talk that well together. So this will allow us to learn about cases in a workplace earlier rather than later. So we're better able to determine what the risk is and get involved earlier rather than later.
Thank you, Doctor. Thank you, everyone. This concludes today's media briefing.